So there's certainly a field that is still evolving and changing. So I mentioned before that I think obviously had that option of the implant and the own tissue reconstruction, but now we're not just talking about replacing that volume or the skin defect that is missing. We also want to make sure that patient can actually redevelop their feelings in the breast as well, because one of the most common complaint is that patient feel that the breast is numb and they sort of don't like having this insensate sort of breast that they've got, because it doesn't feel normal to them. So I think if possible we try to see if we can re-innovate the breast, and this is often more commonly done in the setting of using your own tissue, because when we transfer the tissue say from the abdomen, there is often a sensory nerve that we can take, and then we can reconnect that into the breast tissue pocket as well, and that will hopefully help to regenerate the feeling and give and help to minimize some of that discomfort that patient can describe because they can't actually feel anything in the breast. We also want to make the breast feel or actually look more normal, so these days we can refer them onto the tattoo therapist who can add that color of the areola back, and we can also surgically recreate that projection in the nipple as well, so that will also help them to even look more and more like what the original breast is. The other additional thing that I started offering patients the last couple of years is that we can sort of in the setting of an axillary clearance where some of the lymph node is being removed in the armpit area, that I will try to connect up the injured lymphatics from the upper limb into some of the veins as well. And this is it's still quite a new field in plastic surgery, but so far all the results have shown that patients don't develop any symptomatic lymphedema afterwards, which is obviously a very common side effects if patients are having their lymph node cleared. So these additional stages of what we call the lymphovascular anastomosis can help to really reduce the risk of developing lymphedema in the arm, and it's certainly something that we're offering more and more these days to patients. So I think we're still in a phase where we're trying to really optimize the result of our breast reconstruction, because to me it doesn't just have to look good, but it also have to be functional for the patient. So having that additional sensory return and helping to reduce the lymphedema by improving the lymphatic drainage is all very important concept to bring into the breast reconstruction processes.